Hi everyone, I'm Dr. Shen Nagel here at Pediatrics West, and we here realize that these are unprecedented and uncertain times, and we feel the frustration and uncertainty that all of you are feeling too. Some of us haven't gotten a haircut in a while. So we wanted to give you some guidance and potentially recommendations to help you as you're making decisions going forward. I think a really important thing to remember is that because of the uncertainty and because these are issues that we as pediatricians or government officials haven't dealt with before, there will be evolutions and changes over time. Nothing is set in stone, and there will be fits and starts. There's no real playbook for all of this. So be adaptable, and hopefully we can be a source of reassuring and information that will help you as you make these decisions. Some of the things you may be thinking about right now, one is daycare. It's a huge decision at the moment, whether to send your kids back to daycare or not. We've put some guidelines on our website, but I'll try and summarize them here for you. If you can keep your child at home feasibly, that is still the safest thing in terms of infection risk. But we understand that you're having to weigh childcare out of home versus health risks. And if it is necessary that you send your child back to daycare, we think it is reasonably safe at this time. Some of the things to look for in your daycare to make sure it's as safe an environment as possible are limited class sizes to probably 10 kids or less, good health and safety precautions like screening for fevers and illness, and hand hygiene within the classroom, limiting mingling between the classes so that the kids are with their own group all the time, and keeping parents out of the building with things like kiss and drop off type procedures. All of this will help create a more safe environment in the daycare as you send your child back to it. But remember that the big thing with COVID that we're seeing, kids don't seem to get as much serious illness and maybe even get less, are less likely to get infected with SARS-CoV-2 at all. So the main risk is less to the child than the potential for them getting infected and bringing it home to the family. So family circumstances, if you have a grandparent at home, if a parent or sibling has underlying health issues, are going to play a big part in your decision, and all of these will be fairly individualized decisions. If you do send your child back to daycare, be a good citizen. Remember, don't send them if they're sick, especially with fevers, cough, sore throat, vomiting, diarrhea. And if there's someone at home sick, whether it's a parent or a sibling, don't send your child to daycare. And these precautions will help limit the spread of COVID-19 and keep your child, your family, our communities safer. Some of the things we're missing a lot, socializing, youth sports, and then especially as summer approaches, youth camps. So there's a lot of decision making around all of these issues. As in terms of socializing, with Colorado now in the safer at home phase, we can get out a little bit more and try to limit your social gatherings to 10 or less. And within those gatherings, try to maintain distancing, wear masks where appropriate. Doing this will help limit potential exposure risks. Youth sports are a really difficult topic to think about. One is we're really missing them, and kids are missing their normal activities. But they're very variable. It will depend a lot on the sport. Certain sports, like baseball, potentially have less close contact and may have a very different reopening than a sport like swimming, or even more so things like soccer or football. Youth sports organizations and their governing bodies will be likely trying to come up with guidelines, so stay informed about all of these, and recognize too that things will change over time. So there may be some frustration involved if a recommendation changes in a way that limits your child's participation. Some of the things to look for in sports will be decreasing players out of practice, potentially smaller team sizes, equipment cleaning, and health precautions on site like masks when they're not on the field, good hand hygiene. Potentially things like swim meets or tournaments will have to be limited in size, and very likely there will be little or no spectators allowed, at least as we initially open up. Again, remember that many of these things will be variable and change over time and very much dependent on what sport we're talking about. Whether you send your child back to their sports teams will in part depend on the risk of the individual sport and then also your own risk tolerance as a family in terms of thinking about their health risks if they are in a group setting. Another thing, especially as the summer approaches, thinking about is summer camps. This is similar to daycare, where you'd be looking for potentially limited sizes of groupings and activities. The other thing to remember is outdoor camps will likely be less of a health risk than indoor camps, and then at the other end of the spectrum, potentially sleepaway camps are the last to potentially reopen. Gyms, if they're opening, again, look for gyms that are limiting the number of participants in the space at any one time, rotating through equipment, good cleaning and hygiene procedures, whether on the equipment itself or potentially in the locker rooms as those reopen. And again, I can't reemphasize enough, the biggest thing through all of these decisions is to stay flexible, stay adaptable, and recognize that as we all go through this unique experience, a lot of the decisions will change over time. And while that leads to uncertainty and frustration, it's perhaps inevitable given that these are unique circumstances. Some things to keep an eye on with your children and in your family situation. Mental health issues are becoming even more prominent during this time period. There's a lot of stress in the environment, whether for yourself or your children perceiving stress in the outside world or within the home environment. Things like trying to work at home while parenting, especially if you're a single parent, but even in a two-parent household, can be very taxing and frustrating. Stresses like losing a job or worrying about whether you can pay rent or pay your mortgage and potentially losing your shelter are very prominent current time period. Food insecurity is a big issue. And then teens with their isolation, potentially missing out on milestones like proms or graduation, being isolated and losing their normal sources of social support and outlets for their mental health can be big issues that are only increasing right now. So stay alert for any signs in your children of concern, such as mood changes, lack of enjoyment of activities, changes in sleep, eating, or energy patterns, more irritability. All of this may be normal under current circumstances. All of us are probably experiencing some degree of these things. But if they're starting to negatively impact your child or your family more, then definitely give us a call. We can talk through it. We can arrange a telehealth consult or even a referral to our JCMH therapist. A couple other things we wanted to talk about in relation to the epidemic itself. A big topic of conversation right now is testing. So we wanted to address this a little bit. There are two types of testing that are being talked about in general. One, more recently, is serology or antibody testing. These are blood tests, typically looking for whether a person has had an infection in the past. There's a lot of discussion about whether these are useful or even necessary to reopen our state and our country more safely. Currently, there are a lot of tests available, but they are not all very reliable. So there is a lot of concern about what a positive test result will mean. You can have an antibody test, and if you have a positive test, it can be a true positive, which means you had the disease, or it can be a false positive, which means it's a test error. And currently, with a lot of the tests, there's enough crossover with existing coronaviruses that typically just cause the common cold, that there are a lot of false positive results, and to such a degree that if you had a positive antibody test, it's possible it's only about a 50-50 proposition as to whether that's a true positive or a false positive. So it's really difficult to make any meaningful decisions based on serology at the moment. We will keep up to date on this information as it evolves, and presumably testing will get better. But at the moment, we wouldn't recommend widespread serology testing. The other type of testing that you may be familiar with are typically the PCR testing. These are the ones that are done mostly by nasal swab or you may have heard people report the nasal pharyngeal swab, where there's a Q-tip stuck way back in your nose, as far back as they can. It's not a very comfortable procedure. These test for whether you have the infection at the moment. And these are the tests that there have been a lot of reports of not having enough of initially. We weren't able to do many out of our office. Even now, we still can't do many out of our office. We are getting to the point where we can test just about any kid with symptoms, but we usually have to send them through Children's Hospital. The state of Colorado is ramping up its capabilities in terms of testing, and the hope is that in short order, we will be able to test anybody with symptoms, and that may include doing a lot more tests out of the office. Again, check our website or our Facebook page, or give us a call. We'll keep everyone up to date on the state of testing, both in the area and in our office. Last thing I wanted to talk about in regards to the COVID epidemic is something called a multi-system inflammatory syndrome in children related to SARS-CoV-2 or COVID-19. You may have seen this in the media. There's been intense media attention to it recently because it's a very serious illness, very serious complication of COVID illness in children. First thing to remember is it's extremely rare. Even in the kids who get COVID-19, it's rare. Second is these are very sick children, and they typically present with prolonged high fevers, often in the 103 to 104 or more range. And most of them are presenting with severe abdominal pain and some combination of vomiting and diarrhea. More rarely, they might have rashes, red eyes, or shortness of breath as part of their presentation. So it presents a little differently than the acute COVID-19 illness. The main thing is that these are very sick kids. So if your child has a rash but no fevers, or mild abdominal pain and vomiting, and isn't terribly ill appearing, they likely don't have this multi-system inflammatory illness, also known as MIS-C. If you're concerned about it, give us a call. The first cases as of May 20th were reported in Colorado at Children's Hospital, but again, it's very rare. It seems to be a later complication of infection, so it doesn't happen in the first week or two of infection, but we are seeing cases present about a month after the peak in a community. So that's where we are in Colorado, so it's not surprising that we've seen our first cases now. If you have questions about it, give us a call, talk it through with our triage nurses or your providers. But remember, if your child isn't super ill appearing, isn't having high fevers, it's unlikely to be MIS-C. To sum all this up, just know that we're going through this time of uncertainty and unprecedented epidemic with you. It's a new thing for all of us in pediatrics. It's a new thing for government officials who are trying to make decisions. So hopefully we are able to provide you with some guidance and some reassurance. We will keep you up to date as best we can, and as our clinical practice and decision making continue to evolve, hopefully that will help you as well. In the meantime, as we start to reopen up, keep washing your hands, keep wearing your masks in public, distance as much as you can, avoid large gatherings, play outdoors, and stay healthy. And from all of us at Pediatrics West, thanks for your support, and we will hopefully see you in the office when you need to be seen for well checks, and if you need to for a sick visit. We think we have created a very safe environment, so we wouldn't want you to avoid visits out of fear of contagion.